To understand what dry eye disease is, you need to understand the tears that your eyes make. So, dry eye disease is simply a deficiency of the natural tears that your eyes are producing. So, to understand it, you'd have to understand what goes into these tears and how the deficiency can be caused by multiple factors. So, let's talk about our tears. The tear layer, or tear film, is made up of actually 3 layers. So it's not just tear, water, or what a lot of patients sometimes think. So 3 layers go into our tears. The first layer is an oily layer. It's on the outside of the tear film. Okay, that's what makes the tear film smooth, which you need in order to see clearly. And that's what prevents your tears from evaporating right away, is that oily layer. And this layer is created by these glands in our eyelids called the meibomian glands. And those are the glands that express the material to make the oily layer of the tear film. And what a lot of patients don't understand is that needs to be addressed in order to truly cure your dry eye disease, because it makes no difference how good your tears are on the eye if the meibomian glands aren't making the oily layer. Then those tears are just going to evaporate, and that tear film is not going to be completely smooth. So that's when you start getting the blurry vision with the dry eye, the itching, the redness, and that feeling of having a sand or something in your eye. So that's the first layer, the oily layer. The second layer, the aqueous layer we call it, or the watery layer, is the middle of the tear film. And that makes up the majority of what the tears are. And this layer cleans the eye, it washes away particles that shouldn't be in there, okay? That layer comes from your lacrimal glands, which are in your eyelids and as well your orbit, and they get a signal and they create that watery layer. The last layer, the mucus layer, that's the inner layer, so the closest one to the eyeball. And those are created by these cells called goblet cells, and they're inside what we call the conjunctiva, and they create the mucus layer. And without this mucus layer, that tear will not stick to the eye. So it would just come from the lacrimal gland and slip right out. So you need it to stick to the eye in order to protect the eye. So essentially, you need the oily layer so that the tear doesn't evaporate and it stays smooth so that you can see clearly. You need the watery layer because that's the layer that cleans the eye and washes away things that are in the eye. And you need the mucus layer so that the tear actually sticks to the eye and maintains its smooth shape. So essentially, if anything is wrong in any of those 3 layers, then you have what we call dry eye disease. Your tear is either evaporating quickly, it's not working, it's not sticking to your eye, it's not cleaning out the particles as it should. So that's what, in a nutshell, dry eye disease is. Okay, and then symptoms of dry eye disease, it can be anything. Your eyes are stinging, burning, feels like there's something in them. Blurred vision, especially when reading or using the computer, and that's because we don't blink as often when we're using computers or reading. A scratchy feeling in your eye, the eyes get red, irritated. It's painful to put your contact lenses in your eye. Your eyes are tearing, which I'll go into another video because that's a common question. Why, if my eyes are dry, are they constantly tearing? And there's an answer for that. And so all you see that any of these things can create those problems and need to be addressed. So sometimes just putting an eye drop on doesn't help because the eye drop essentially replaces the watery level. You may need something to help your meibomian glands express the oily layer better to keep your tear on, so the eye drops aren't going to do anything. You need lid hygiene, lid scrubs, or the mucus layer, the inner layer, isn't working correctly, so you may need additional treatments. That's when you start to get into some of the prescription stuff, procedures. But essentially, just putting artificial tears in sometimes is not the solution, because the problem is one of the other layers of your tear film.